Here are 5 mental health issues that I'm seeing a lot more of during the COVID times. Hi, my name is Dr. Era Dutta and I'm a consultant psychiatrist and a therapist. I'm also a life wellness coach. We are here today to talk about 5 kind of mental health issues that I'm seeing skyrocketing, especially in the times of COVID. Now, mind you, these issues have always existed. In fact, they've always been prevalent. We've just not noticed them, or we don't know yet so much about them. So one of the main things, which is the purpose of my life, is to educate and impart scientific knowledge about mental health to people. This is my platform and thank you for joining me. I'm going to talk about 5 mental health issues which have skyrocketed, which have increased tremendously, and people are coming forward to at least seek consultation for them. Thank God for that. 5 mental health issues that I'm seeing a lot more of during the COVID times. So number 1, sleep issues. Yes, insomnia has become sort of a middle name for a lot of people during this pandemic. Sadly, the poor lifestyle is one of the main reasons why people aren't sleeping very well. So if you're in this bracket, just fix your lifestyle, make sure you get a little bit of exercise so that you're tired physically and mentally, and hence you'll be able to sleep a lot better than before. Number 2 is anxiety. Yes, we're all getting a little bit anxious that when will this pandemic end? I'm with you on that. So of course, this kind of anxiety is very natural and normal. However, a lot of us have started thinking into the future, a lot into the future. Please know that of course this pandemic is getting to all of us. However, looking for that expiration date on the pandemic may not be the wisest thing. Rather than that, make the best of what resources you have at the moment is actionable advice. OCD. Yes, OCD has obviously increased during the pandemic. OCD, for those who don't know, is obsessive compulsive disorder. Fear of contamination, constant washing of hands and cleaning of surfaces obviously is recommended by the WHO. However, some people tend to overdo it to the point of excoriation of their skin, to the point of constantly washing their hands, their utensils, their hair over and over and over again, to the point where they actually end up falling sick as well. So please know that how much is too much. It is obviously very important to keep things in moderation and yet be safe. The 4th common thing that I'm seeing in this pandemic, which is again increasing, are relationship issues. Now you may wonder, how are relationship issues related to COVID? Well, they are. We're all staying a lot more at home. We're all obviously having a lot more time with each other, which is good. However, this quality time cannot always be there. There are certain relationships which are strained. There are certain relationships which do well with a little time apart. And for those relationships, obviously, the COVID is causing a lot of trouble. And number 5, depression. Yes, you heard me right. Pandemic is causing a lot of people to feel depressed. Social isolation or social distancing or not meeting friends is one of the main ones. We all are social animals, and as much as we love spending time on Instagram or social media, but we need to interact socially face to face at some point. Sadly, that is missing during this pandemic. How we all wish that we could just go out and hang out with our friends, right? Also, one of the other reasons why depression is skyrocketing right now is because pandemic has taken away a lot of jobs, a lot of livelihoods, and causes a lot of strain on people's body. So if you relate to any of these 5 conditions, I really urge you to speak to a mental health specialist. The reason being that you may not really need pills, but just may need some psychological advice, what we call as therapy or counseling. All the best. Stay well, stay safe.